He's really, really dangerous.
On this episode,
Put that pressure on. He's too heavy, we can't get him up. He is an absolute monster. Righto, pressure on. We're in all sorts of trouble. Let's go, get him out.
Oh, I know it's sore. It's a really good idea for us to do an x-ray. All right, let's have a closer look.
Oh wow. Nothing like a good challenge.
That's huge. Look at that.
but first,
Guys, I need oxygen. I know that I've got to try and do anything I can to see if I can save this puppy. We are not breathing, but with puppies, you don't give up. You've got a urinary bladder. That is good. So yeah, so there's like a little bit of free fluid right there. You see how there's almost like...
At Sash in Western Sydney, it's a super busy Friday night for emergency and critical care specialist Mara and her team.
Friday nights get really busy in emergency, but generally what happens is reg vets close for the day and then animals start to get sick, and that's why we're here. Probably going to need broad spectrum antimicrobials very, very quickly. Sometimes it's just a continuous, another patient comes in, another patient comes in. They're relatively stable, we can do things in a stepwise fashion and life is good. I mean, you do what you have to do. When there's a big bleeding wound, it is better to get it to stop than not. You've got stuff coming out of the drains and falling from the ceiling on you, and animals being rushed in one after the other.
Coming through.
And you are trying to literally back and forth deal with 2, if not more, patients at the same time.
Oh, Lord.
Oh, baby.
And more patients keep arriving.
All right, your job besides that is going to be to check the temperature every 5 minutes or so.
Hi,
Mamacita!
my name is Pippa.
The newest one is Cocker Spaniel Pippa, struggling with a difficult birth.
Hello, gorgeous. Oh my God, you are so cute. Who's so good? Okay, did you have babies? And they're not well? And we need to check you out? She had 2 puppies earlier, and they both died. And we don't know if she has any more inside. I might need another person. I think our mama girl is going to be a little bit wiggly. I really need to see if the puppies are there and if they're alive or not. Should we see if you got more babies in there? Should we check you out? Let's check you out. Sometimes we have dogs that just stop their labor. That's not a normal thing to happen. There's usually something bad going on. It may just be that the uterus itself is exhausted. So, looking to see, there's at least 1 skeleton inside. Important question is there a little heart beating in there? I'm just trying to get to her chest, see if I can see a heart beating or not. And you are a little anxious, lovin'. I don't think I'm seeing a beating heart.
There she is!
At the Australian Reptile Park, alligator expert Billy and his team are on a dangerous mission.
Come on! So I'm going to call the gators. Yeah. Come on. Yeah.
At the end of a particularly brutal breeding season,
It's hardcore. Watch out.
it's time to round up any wounded gators.
So this one over here is the one we actually need to catch, half-tail, the one we're targeting today.
One gator in particular, Halftail, has been spotted with a nasty injury.
Half-tail has been our most dominant female alligator out on the lagoon here for like 15 years. And she originally lost half her tail, hence the name, in a big fight with another female. Look at those teeth. She's been involved in a pretty hardcore fight with one of those girls. Far out, that looks nasty. The other female's bitten off part of her jaw. She's literally watching us right now.
But to reach the wounded female, Billy and his team have to deal with some of the aggressive big boys first.
Just watch, we've got a big male coming in right here. That looks like Ivan.
No wonder Halftail is playing hard to get.
Hopefully we can get her. But she's just spooking a little bit at the moment because of these big boys.
The massive male bullies aren't moving out of the way without a fight.
One in particular, Ivan, I reckon we've got to catch him. And I reckon once we get him out of the way, we're going to have a better shot at her. Come on. Pull it. Just watch that post and move past. And I'll try and get him out. Come back this way. Now go around. 3, 2, 1. Hold up. He's too heavy, we can't get him up. You know, straight to this.
Pull through here.
I don't think I'm seeing a beating heart. There. Oh, you're a good girl.
At SASH in Western Sydney, emergency specialist Mara is anxiously searching for a heartbeat, hoping that Pippa's unborn puppy is still alive.
Girl. Let's see to see if your baby's okay.
The Cocker Spaniel was rushed to emergency after she delivered 2 deceased puppies at home.
Ah, beating heart! Heck yeah! One baby's alive. Okay, let's see if we got more babies. It can be hard to know how many puppies are there based on ultrasound, but one thing that ultrasound is really good at is it can help us see if the heart is beating and if the heart is beating fast enough or too slow, which can let us know, is it appropriate to do medical treatment. You see that flickering in there just to the left of the screen? You've got a live baby and that heart rate is a good heart rate, so that is good. Good job, good mama. Yeah, you were very brave. And look at the rest of you then.
With a third puppy potentially in danger, Mara urgently needs to find out why Pippa's labour isn't progressing.
All right, so we've got at least one baby who's healthy, as far as I can tell, which is good. We will just have to see
That's good news.
why she has stopped passing her puppies out. Look at how big your paws are, they're gorgeous. You know that? All right, sweetheart. You need your hind end. Perfect, thank you. Okay. Oh, you're doing a vaginal exam so that I can see if her cervix is still open. It is. And she's not doing any muscle movements in response to this, and if she was in active labor, I would expect. But I can feel something. Are you thinking of trying to get a puppy out? Sometimes we can have other things that can affect the uterus's ability to be able to contract and basically push the puppy out. So sometimes our patients have a low blood sugar level because they're just exhausted and don't have any more energy. Sometimes their calcium level is low, and calcium's actually an electrolyte that's really, really important to help muscles contract anywhere in the body. Mamacita, your calcium's a little low. But we can fix that. We can fix that. Yes, we can. And then we give oxytocin, which is a hormone that is used in women when they are induced for labor, and we use it with dogs. Basically what that does is that triggers the uterine muscle to start contracting. Oxy in, calcium in, all good? Yay! Mama, should we get you settled somewhere nice and cozy? Okay, you go to bed.
If the oxytocin doesn't work, Mara's concerned that Pippa may need emergency surgery to get her puppy out safely.
So it's a lot more invasive doing the surgical approach, but sometimes that's what you need to do to try and get live puppies out. Yes, I know, Mama. And get a little live puppy out sooner rather than later.
Ready? Come on.
In Sydney, elderly dog Xena is in the wars, struggling with an extremely painful sore foot.
Xena is a rescue pup. I've had her for about 10 years and I got her when she was about 3 or 4 months old. She was found with her mum and a litter of her siblings under a house in Walker somewhere. Yeah, she's been with me ever since and yeah, love her to bits.
Xena's owner Benita is bringing the 10-year-old Great Dane boxer cross to see Audrey to check a nasty growth on her paw.
Hi, Benita. Hi, Zena, my old girl. How's she going?
Yeah, she's all right. She's a bit sore.
Oh, you look like you have a sore foot there, all bandaged up. Well, let's have a look at it. Come on in.
All right. Let's go.
Limpy, limpy. All right, come on in. Have a seat. All right, check it in. Let's see what's going on. I can see that she's limping on that leg. It looks very sore.
Turn around.
Turn you around. Turn around. Okay. All right, so what's been going on with this foot?
She had a lump on there that I initially thought was an infected cut, but over the last probably 2 weeks, it's grown sort of exponentially.
Okay. How much do you think it's grown?
Oh, quite a few centimetres, yeah. And it initially looked like just one toe, but I feel like it's 2 toes are quite swollen now.
Quite swollen, yeah.
From what it looks like, yeah.
Because obviously when you get a little swollen lump, it could be something like a graze or a cut or grass seed or something like that. But if it's growing that quickly, then your concern changes a little bit as to what it might be.
Yep.
So I'll take that lovely bandage off that you've done such a good job doing and have a good look what's going on. To hear Benita say that this small lump has grown by centimetres, that's huge when you're talking about a toe, because every centimetre makes it harder to remove or do anything on that toe.
Oh wow. Oh, I know it's sore. Oh, let me have a look at it first.
All right, so just looking at it, it is huge. It's obviously bursting and very sore because there's not enough skin there, but it does look very fleshy. And I'm feeling the third toe here and the bones actually feel okay. So for that reason, I think it's a really good idea for us to do an x-ray because I might be able to save that toe. We might not have to amputate it. It may just be resecting the mass off. I may not get clear margins, but at least maybe we can have a chance of saving the toe.
Yeah. Whatever it takes.
Yeah. Because Xena is an older dog and a large breed dog, general anaesthetic is risky. We've got to do a few diagnostic tests before I get a good plan of what we're going to do, so we have to move quick. Now we've got Xena asleep, I can have a really good look at it without hurting her. And it does look very fleshy. You can see where she's been licking and it's all red and raw. But there's definitely almost like this fleshy tumour or something that's just sticking out of this third toe. But what I really want to feel is if the bone underneath is affected, and that actually feels quite good. I can feel the bone sitting on top of the lump and it just feels like the lump is coming out of the tissue around it. Okay, so I'm just going to take a fine needle aspirate of this lump. So that's where I stick a needle in and pull back on the plunger to grab some cells from it, and then we'll spray it onto the slide and look down the microscope. And hopefully that will give us a better idea as to what it is. And it does feel very soft.
She's right there where those bubbles are coming up. Do you see that? Yep.
At the Australian Reptile Park, after a ferocious alligator breeding season, Billy and his team are trying to capture one of the casualties, injured female halftail.
Just spooking a little bit at the moment because of these big boys.
Halftail will have to wait. Some of the big dominant males have moved in close, so Billy's rounding them up and checking their wounds first.
There's a big Ivan coming in. Yep, keep going, keep going. He's too heavy, we can't get him up. He's gonna roll, he's gonna roll. Ooh. Ivan is just full of absolute raw power. He looks like he's gonna actually start rolling. If he rolls, we're in all sorts of trouble. He's coming. Go, he's going. Pull. 3, 2, 1. When you see the size of these boys, you can see the power that's coming out of them. It's insane. Let's go, get in it. You can only imagine what they're doing to each other in breeding season, which is why today is so important. So keep that pressure on. Go. 3, 2, 1. There's that other foot, Bill. It's sucking in that mud. Go, pull. Go, get him, pull. He's too big. He's too big. We just need to get him another 2 feet and we're good. Righto, pressure on. Again, 3, 2, 3, pull! Okay, here with the right, the tree. That'll do. The tree. Come around this. I won't go over, Jill. How's the size of this bloke? He's got to be close to 4 metres. We've got paint, everything ready? Yeah, paint's just on that. I'll just see what he does before you jump on, Mitch, just because of the water. I'm a bit nervous. 3, 2, 1. Jump on, Mitch. Check to make sure they've got a microchip. If they don't, we give them one.
Billy, we've got 2, 3, 4, 5. It's Ivan.
Oh, beautiful. Just make sure that pressure stays on that rope.
He's building.
Watch those back legs. Overall, pretty good result.
Lethal Ivan has survived the dominance fighting unscathed.
Pass me the paintbrush, please. We need to know who we've caught, so we actually just put a little bit of paint across the back of their neck. Adam, you want to start loosening this rope. Give me a bit of...
This is a scary part, removing the top jaw rope and freeing an angry killer reptile.
Mitch, you're good to go.
Yeah, mate, I'm ready when you are.
Small rope, Adam. Go. Done. So Halftail's still out against the snags over the back here. I reckon she's shy because this big fella's still against the ramp, so she's the one we actually need to catch.
Because we are at capacity at the moment. How's that one doing?
At the busy emergency department at SASH in Western Sydney, pregnant Pippa has suddenly started showing signs of labour.
Gloves.
And Mara quickly swings into action.
Hi. Okay. Looking in, I see there's this puppy completely enclosed in the sack with everything still attached, not moving, looking like it's dead. Okay. Yes, scream at me. Scream at me. Get mad. I know that I've got to try and do anything I can to see if I can save this puppy. Guys, I need oxygen. Trying to get its airways clear of fluids. My goals are the same for any patient that comes in unresponsive. I'm looking at the ABCs. So do they have an open airway? Are they breathing on their own? And is there evidence that their heart is beating? Can someone get me a new towel, please? I'm trying to get oxygen into the puppy, either through the oxygen mask or even doing a little bit of blowing directly into its nose with my mouth. All right, if you could go into the crash cart, please, and see, open up a vial of adrenaline and just get me a little bit in a syringe because I'm going to give our friends a little drop of adrenaline. And I'm vigorously rubbing the puppy because that's the best way to get stimulation, both to the lung, get mad, and to the heart to see if we can't get anything to start to move in the right direction. We are not breathing, but with puppies, you don't give up until you've been going for quite a while.
Halftail, she's the one we actually need to catch.
At the Australian Reptile Park, alligator expert Billy and his team are still trying to catch injured female halftail.
Come on. Yeah. Halftail has proven really hard to catch, and Googly's making his way in, so I reckon we take the opportunity to catch him. Come on.
One wrong move with this big boy could prove fatal.
Try and walk him up as far as we can so we haven't got to drag him so far because he's so heavy. Googly is our biggest and most dominant male on the lagoon. He is an absolute monster. He is huge. He'd be over 400 kilo and almost 4 meters in length, and he's really dangerous, so we really need to watch him today. Yep, jump on. Yep, we got him. And Mitch, also, while we're doing this, you've got to keep an eye out for other gators. He's really, really dangerous. He's probably the most dangerous gator we have here at the reptile park. Blindfold. 3, 2, 1. Oh, his osteoderms are driving into his sternum. They're killing. His osteoderms, they're a floating bone plate under the surface of his skin, are jamming into my sternum. It hurts so bad. My arm's going dead underneath him because there's so much weight on it. You couldn't make a mistake here. You couldn't end up with any part of your body inside of those jaws. It'd just be game over. All right, paint, please. He's been fighting this breeding season, and he's been punching on flat out with other males. He's got a couple of old bite marks on the side of his neck here that are healing up fine, but we just got to keep an eye on those sorts of things. I can feel him building.
Yeah, I can see it.
He's taking big breaths, ready to go. If he wants to, he flick me like that. Do you want to loosen this rope so I can have a bit here? Righto, Huey, you want to go? Yep, go. Great.
With the battle-scarred Googly heading back to the lagoon, Billy wants to see if injured Halftail has moved in any closer.
Halftail's right there. Can you see that? She's spooked again.
Hopefully that will give us a better idea as to what it is, but it does feel very soft. All right, let's go stain this.
In Sydney, Audrey is investigating a worrying lump on 10-year-old Zena's paw, hoping it's not a nasty tumour. Cells taken from the lump will give Audrey a good idea of exactly what she's dealing with.
Okay, so definitely we've seen some blood and a lot of white blood cells, so inflammatory cells, and a few sort of round cells that don't look like the nasty type, the typical nasty type. So we could be looking at something inflammatory rather than tumour, but this is only a snapshot of what we're seeing. It's probably best that we take the mass off, but that makes me feel a bit better. The X-ray will help me determine whether the bone underneath is affected or whether it's a bony tumour, and that's going to affect whether I remove the whole toe with the bone or I just try and remove this mass. We want to do the best thing for Zena and make sure it doesn't come back. Should we stay like that? All right, X-rays. All right, let's have a closer look. So I've taken 2 views of the paw and having a look to see whether the bones in the toes are involved, and it's really good news. All the digits are clear, the bones look perfect, so it looks like it's just soft tissue. So good news in the sense that Zena gets to save her toe. I'm really happy with that. Let's go tell Mum the good news. So it's good news so far. So I've done the preliminary test that we talked about, so the X-ray, the blood test, and an aspirate of the lump. Now the good news is the bone is completely fine. So the 3rd digit and the 2nd digit, they look beautiful. The bone doesn't look like it has any tumours or anything in it. So my next step is going to be trying to remove this lump as a soft tissue and leave her toes intact, which is good news for her. It will mean that the recovery is a lot less traumatic and a little bit easier for her as well.
Cool, thank you so much.
All right, I'll be in touch soon.
Thanks, Audrey.
Don't worry. Okay,
Bye.
bye. So now we know what to do in terms of what we're removing. I'm just figuring out, once I remove it, is there enough skin to close? Because whenever you're dealing with an extremity, like a hand or a foot, there's just not much skin there. And so we remove a big chunk of it, you got to figure out how you're going to close it. So things like skin flaps, rotational flaps. I'm just going through that in my head and thinking about where I can grab some extra skin to close this down. It's going to be a bit tricky. You can kind of see where it's burst through the skin. Look. Well, just so the tricky part is just trying to remove the lump between the toes, because one of the toes is right in the way. So I've almost got to open it, separate it, and then just try and get between it. Nothing like a good challenge.
We are not bleeding, but with puppies, you don't give up until you've been going for quite a while.
At SASH in Western Sydney, emergency and critical care specialist Mara is desperately trying to revive Pippa's new puppy.
Unfortunately, I have no idea if we'll get this puppy back.
Pippa has had a complicated labour, and her first 2 puppies were stillborn.
Are you comfortable rubbing our friend like hell? Yeah. Great. Because I'm going to give our friends a little drop of adrenaline. Keep rubbing or stop? Nope, keep rubbing. Okay. I'm going to borrow your stethoscope while you're taking that. You can stop for 1 second. Keep going. Really, with these ones, if after 30 minutes of very vigorous rubbing, oxygen, a little bit of adrenaline and atropine, you get nothing, only then do you finally give up. Yeah. But you just keep going and going and going because it takes them a while to realize that they should be alive. Well, it's hard. I know that this was not a planned pregnancy, but I know that Pippa is definitely a very beloved member of the family. And while there's always good and interesting things with emergency medicines, I don't have a great feeling about this. Yeah. Sometimes we don't win.
I couldn't hear one.
Yeah, no. I think we're done. Thank you, but we're done. And while it's sad, I can't sit and dwell on it for too long because there tends to be 3 or 4 other patients needing me to help them. Hi, baby. I'm sorry. I think you just took too long. Okay. You give them a couple of minutes of thought. Might think about it some more on my drive home later on, but I oftentimes have to basically switch that concern off and move on to the next. Hello! We're gonna poke you, little oven. All right.
Now Mara is turning her attention back to Pippa, increasingly concerned she might still be carrying more puppies.
And I'm just checking right now with ultrasound to see if there's any other babies that I can find. There is one, at least one more in there. I'm just trying to see if there is a heartbeat. Yes, there is a heartbeat. There is at least one more puppy in here with a heartbeat. Yes. Oh, beautiful. All right.
Half-tail, she's spooked again.
At the Australian Reptile Park, Billy's trying a new tactic to hopefully lure in wounded female half-tail.
I'm just trying to lure her with food. She's just turning again now. She's spooked and gone out the back again.
While half-tail continues to play hard to get, more of the other dominant males and females can be checked for injuries.
Get ready on the end of the ramp here. Go up a bit further. Yep. Yeah, I'm good. Keep that pressure on. He's gonna see which way he wants to go. Righto, pressure on. Just watch, we've got this other boy coming up. 3, 2, 1. She is massive. Be careful where you put your fingers now. 2, 1. And that's all of them.
With the most dominant, injury-prone males and females now tagged and given the all clear, the team can again try to round up the one they're most concerned about, half-tail.
Catching half-tail has proven to be really challenging. She's just sort of hanging at the bag, poking in. I've got gators all around me at the feed ramp, including half-tail, but she's just a little bit too far away. Hey. She's moving in towards me. I've got the rope there ready to go. All I've got to do is get her on her jaws. Almost had her then, like so close. Come on. She's right there. Come on. Yeah. I've got half-tail on the rope, right there, almost completely secure. Oh, that gator just... And then the male right next to her, knocked that rope straight off her jaw, and she's just speared back into the water. Now she's gone. I'm gonna have to try something new. Watch her.
Once I get mama and babies out of here, I'm happy then to lay hands on this one.
At Sash in Western Sydney, Mara and her emergency team are still flat out.
You just had a baby!
When suddenly, pregnant Pippa delivers her 4th pup.
Good girl. Good girl. Literally 2 minutes after the last check, she's just had a puppy. And so by the time we got there, she'd already licked the puppy clean. We missed the entire thing, but she did a good job on her own for that puppy. There's a little girl. You got a little girl. Oh, good mama. It's always great to get to see a live puppy come out, especially when we know that there's been dead ones that have come before. It just really gives us something positive to focus on when we've been dealing with sometimes some sad emergencies. It's a nice little gift. Yes, we want baby screaming. What do you think? Are you gonna clean her up? You go, mama? Yes, you are. She can hide under your ears. You know that? You could hide under your ears. So Pippa's gonna go home, and she's probably gonna be a really good mom for her baby, because how she's acted here in hospital so far, she's very, very involved. So I expect she's gonna spend the next couple of weeks at home, mothering that little baby, probably being really happy to no longer be pregnant. You're a very good girl. Yes, you are. Oh my God. Oh, you're too cute for words.
But she's under. There she is.
At the Australian Reptile Park, Billy still isn't having any luck trying to capture dominant female halftail to check a nasty wound on her jaw.
And I just need a croc stick down here, Dylan.
Billy suspects halftail copped a serious bite during an aggressive breeding season.
I actually got a really good look at the injury across her nose there, so she's actually lost a fair bit there. I need to have a closer look at it. All right, boys, we got her.
Finally, success.
Come running in. Grab these rope. Turn it right. Just swing her.
What's the jaw? What's the lower jaw?
Lift it, lift it, lift it.
All right, start pulling. Go. This tree over here,
Watch out, watch out.
Yeah, well, hold there.
Right, I'm going to blindfold. Just keep an eye for alligators. Just give her a sec. She's normally pretty wild, this one. Good with scanner, paint. Alrighty, let's do this. 3, 2, 1. Far out, that looks nasty. Have a look. Jeez. I can see here, like she's lost a fair whack of that top jaw. Really good bite, but looks like she's healing up pretty well. Alligators have got a fantastic immune system. They've literally got their own antibiotic in their blood system, which helps them combat these injuries.
I've got no slack on that.
Alright, no worries. She can feel that straight away. She's going.
Halftail has been lucky this time. If the wound was any larger, she would have lost her nose, a fatal injury for an alligator.
Far out, that took us all day to catch her. What a challenge. I'm stoked with how well today went. Halftail looks fantastic. She's healing up great. All the alligators look fit and healthy. Great result.
Nothing like a good challenge.
In Sydney, Audrey and vet nurse Emma are in the middle of a tricky surgery to remove a large and painful lump from rescue dog Xena's paw.
I'll pass it to you, and you're going to pull in this direction. All right, it's coming away now. That's huge. Look at that. Oh, that's a lot. I'm actually surprised it's quite capsulated. I wonder if there is something in the middle of that, but we'll find out later. She'll be feeling a lot better with that out of her toe, for sure. So lumps come away quite clean, and this was the challenging part, just closing up the skin. But pleasantly, I'm quite surprised. It's coming together quite nicely, no flaps needed, so very happy. I was in two minds at the beginning of what we were going to do today, whether we remove the toe or whether we just try to remove the mass. But I'm quite confident with how it came away and with all the diagnostic tests we've done, that hopefully it's not a nasty tumour and Xena gets to keep her toe. Oh, beautiful girl. Okay, yeah, there's your tongue.
3 hours later, Xena's owner Benita can't wait to see her special girl.
All right, look who's here. We're still a bit groggy, Mama. Oh. Look at Tails, Maggie.
Oh, hello.
Show her your paw.
Oh, yes.
It looks much more normal, Mum.
Thank you. Thank you so much.
So surgery went really well. We just took away the fleshy mass and the bone was completely okay underneath, and that just came away as a really nice capsulated mass, so really easy to actually come away.
Oh, beautiful.
And there was enough skin to close, so it should heal beautifully. And I actually have saved the lump for you to have a look at before I send it off to the lab.
Oh. Wow. Oh, that's disgusting, but very interesting.
Yes, I mean, as gruesome as it looks, it's quite good for us to have a look at it because it's capsulated, it comes away as a whole. I don't feel like we've left anything else in there. And looking at the aspirate as well, it didn't look too nasty under the microscope. So hopefully it's a non-nasty one and we don't have to go back in and take anything else out.
Really good news.
Yeah.
Thank you.
But yes, we're still a bit groggy and we're still learning how to walk on that bandage. But once she gets home, she'll be a lot better.
Yeah. She'll feel comfortable at home.
Yeah. All right, so I'll let you take her home.
you.
She's keen to go, the tail's wagging. And I'll see you in a couple of days. Thank you for being so brave.
It was much better than I expected. I was really expecting her to lose a toe, and so to keep all her toes and be mobile, it's just really great news. And hopefully it's nothing too nasty as well. Thank you so much. I really appreciate it. All right, well, thank you. We'll see
Bye,
you.
Zena.
Come on,
Bye,
Zena. Out this way. Bye. Thank you.
Keep going.
In Sydney, Kate's on a rescue mission.
And we're going to see Axel, the 8-month-old boxer who is driving his parents absolutely mad.
Jess and Jerome live in a ground floor apartment with their 4 children, and a very noisy and boisterous boxer called Axel.
Knock, knock. Hello.
Dr. Kate.
How are you?
Good, come on in.
Hi, beautiful boy.
Down.
Hello.
Boy.
Come on. He's looking beautiful, you guys.
Oh, we love it.
Do you love cuddles? You do love cuddles.
I have known Axel his whole 8-month life, and he is absolutely beautiful. But he is driving Jess and Jerome absolutely up the wall. So you guys have called me for a very specific reason.
Yes, barking. Barking when we don't pay him any attention.
Okay.
As soon as we talk to each other or we watch TV and we don't pay him the attention, then barking. Down, Axel. He's our first dog that's ever graduated from puppy school, so we were really proud of that. But after that, it's like, how do you train your dog to make sure that they don't do things that are annoying, like barking? We live in an apartment block, so we have to be mindful of everyone else, and we hate for him to bark.
Yes. That's something that is going to cause these neighbours to complain.
Down, Axel.
May even result in them having to rehome or actually get rid of Axel. And what happens when you ignore him? Because I presume that you've tried that.
It just gets worse.
Okay.
We end up either taking him out for a walk or giving in to him and giving him something.
All 4 of my children know he's my favourite child. We just love him, but we have to do something. We just need to stop it.
He is like a 2-year-old child. Exactly. He is like, everyone pay attention to me at all times. It's out of control. They can't continue as they are. We have to figure out a solution for them.
Down, Axel. Down, baby.
I'm going to get you guys on the couch. I'm going to get you pretend to watch TV like you would at night. And I'm going to sneak around the corner and see what he actually does.
Okay.
Kate wants to see for herself Axel's behaviour when he's not the centre of attention.
Axel, down. Axel, Axel, down, baby. No. Axel, no.
This is out of control. They live in an apartment building. They can't have this continue on.
Why are you barking?
It's not a good boy. Not a good boy. You get all the attention. Our biggest fear that we have to get rid of him, and that's just not an option. It's like saying get rid of one of your kids. Axel.
It doesn't take Kate long to work out why Axel is so needy.
He's relying on you guys to entertain him, and he doesn't like that you two are interacting and ignoring him. And exactly what he's saying is, I'm bored. Yeah. He's saying, bored, bored, bored. I'm bored. I want you guys to entertain me. Boxers are absolutely lovely dogs. They're one of my favourite breeds, but these guys are absolutely high energy.
We can throw a ball forever, come home, we're tired, we'd want to sit down, have dinner or watch some TV, and it's just, what's next?
But we can't have that go on for 2 or 3 years. And it's not going to get better unless we address it. This is not something that Axel is going to outgrow. And that's one of the common misconceptions about this, is that they think, you know what, he's just a puppy. The reality is if we don't fix this now and we don't get on top of this now, he's going to end up at 2 or 3 with exactly the same problem, if not worse. If this goes on, you guys are going to get kicked out of the apartment building.
Oh, for sure.
Yeah. Boxers are high energy. They need lots of walking, lots of activity, but they also need a lot of mental stimulation. We're going to teach him how to play by himself without relying on you guys. So there's heaps of puzzle games for dogs. We've got a little activity ball, right, which we load with treats, and then he has to actually figure out how to actually get the treats out. There you go, try that. He's going to spend hours playing with this rather than annoying you guys.
Oh, you got it.
These little brain activities and these little puzzles are twofold. So not only are they keeping him entertained, so these guys can sit on the couch and not have him in their faces, but it's also meaning that he's getting tired by using his brain.
What's in there?
Oh. What I want you to do is put all of his regular food in one of these instead of him getting dinner.
He is so focused on that toy. His paws are working. You can actually like almost smell his brain working.
So the final part of this is rewarding calm behaviour. Oh, oh. Perfect. It's exactly where he's supposed to be. This is the perfect behaviour. This is what we're trying to get him to do. We want him to get to a point that he can relax on his own. It looks like it's a treat for nothing, but it's not. It's reinforcing just that he needs to be calm. Allowing him to teach himself how to self-soothe.
Amazing.
Perfect box of behaviour. This is the way that people should engage with their dogs all the time.
He's not barking.
It's not barking.
So beautiful.
Wow.
Yeah, you can do it.
You're a good boy. Yes, you are.
A week after Audrey removed a worrying lump from elderly rescue dog Zena's toe, the lab results have come back all clear. And Zena's toe is healing well.
Come down. Look what I've got for you. Isn't that fun?
And a month after Kate's visit, Axel's incessant barking has almost stopped.
Yum.
Food puzzles are helping to relieve the energetic young boxer's boredom, and owner Jess couldn't be happier.
We are challenging him every day, and we are watching TV in peace and quiet every night. So Dr. Kate knows her stuff.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way. That way.